The New Zealand Nurses Organisation president is frustrated at the lack of action from politicians across the board to address a health system failing Pacific communities. Kai whakahaere Kiri Nuku says at least 4,000 nurses were needed yesterday. She told Lydia Lewis the Pacific population is at 8% and Pasifika nurses only make up 4% of the workforce.
We believe that there hasn't been a concentrated effort to support the recruitment and retention of Māori and Pacifica workforce. And what needs to change is investment in exactly that, a Māori and Pacifica workforce where it's suitably resourced and it ensures that we can take students that are thinking of nursing, provide the support that's necessary around them, and graduate them into good jobs and then retain them within the health sector.
I know that there's been some pilot programs for midwives, Pacifica midwives, that have seen some success in recent years, and Labour and National have both announced recently their plans to bolster GP workforce and, fund places for doctors. Would you like to see them both do the same for nurses?
What we've seen during COVID is absolutely nurses stepped up. They were doing the screening, they were doing the vaccinations, they were everywhere within the community. Absolutely, the role of nurses are significant and must be matched with any initiatives that they're anticipating investing in for doctors. Absolutely, nurses are, as every politician says, the backbone of a healthcare system. However, they're often the ones that are overlooked.
And why is it important to have Pacific-specific initiatives? There's some concern with at potentially wanting to scrap specific Māori, Pacific ethnic specific initiatives. Why is it important to have those?
We see time and time again the stats that show that Māori are overrepresented in poor health outcomes. What we believe is that having Māori and Pacifica deliver a culturally more appropriate service to our people, and therefore having them the ability to train in a way that best meets their learning needs. Now, we're not saying that it undermines or is lesser than the BM programs that nurses are currently graduating under. But we need to develop and ensure that we have culturally appropriate training programs and so we can deliver culturally appropriate services to the community.
None of the National or Labour announcements were Pacific specific. They were, obviously just about bolstering numbers to address the shortage. Have Pacific specific initiatives been forgotten about so far in the election campaign?
I think not just in the election campaign, but certainly throughout a lot of the workforce planning, it's Pacifica and Māori are overlooked. I think Pacifica are even more marginalised, and that's not okay, especially as I said earlier, given that our people are far more likely to frequent services and are subjected to significant comorbidities and complex health issues. The reason why Māori don't access at a higher rate is because the services are not always culturally appropriate to their needs. And we have Māori presenting late, more complex term within the illness, and therefore more complicated health patterns. I think that when we look over the workforce planning, there has been very little in terms of actualising Pacifica aspirations. There are great initiatives that have been set up, but it requires a lot of resourcing and a lot more future thinking around the population projections and workforce match.
What are some real life changes that could be done to really address this?
So I think we need to start by looking at the data, and we've got to say and commit to, government's work plans need to commit to achieving a nursing workforce population that matches the population of Pacifica. So for Māori, it's 7%, we're 7% of the population, therefore we should at least have 7% of our Māori workforce. The Pacific is the same. We've got to make sure that we do a number of things because we've got a significant international crisis in terms of nursing workforce. So we should not only look at earn as you learn, so we can incentivise training, people to train and earn money so they're not out of pocket, because becoming and completing the BN nursing program takes 3, almost 4 years before we're fully immersed in that workforce and earning money. Students are currently leaving with $30,000, $40,000 debts, so we've got to look at taking away those barriers that stop people from training. We've got to make sure that we support with pastoral care nurses to succeed in that program. The other thing, we've got a lot of nurses that are sitting out there in the community right now that have not got an annual practicing certificate. And to retrain or to get back in that workforce, you basically have to retrain if you've been out of practice for a long time. So the government could incentivise or pay for that nurses to retrain. I think currently it's about $12,000 to undertake that program. That could be reduced because there are a lot of people out there currently in the communities, Māori and Pacifica, that are wanting to get back in the workforce, but that is a barrier to achieving that. We've got to also look at the portability of qualifications between the islands and New Zealand without depleting the people or incentivising people to move from the islands over to New Zealand. We've got to make sure that should they choose to, that we haven't created any internal barriers with the registrations at the moment. I know that Pacifica colleagues are talking about the IELTS or the language requirements to work with inside New Zealand. So we've really got to critically look at the system and see what barriers it currently creates for Pacifica to ensure that there is some active management around those or some priorities around those issues so that we can deconstruct the barriers that are stopping Pacifica nurses from working within the health system.
Thank you so much for that. I've got so many more questions, but I won't keep you. Was there anything else you wanted to add?
Just that we really value the workforce and contributions, and we have a great Pacifica section within our organisation that Aseta Whanau and Abel Smith and others lead. And I think with their passion, they're aspiring to make sure that we're keeping Pacifica nurses within the workforce. But that can be a lonely job if the system doesn't respond in a way that enables that to happen.